This is an interesting case. What do I do, guys? That's the home run. Gotcha.
So much better. Relief. It feels like relief.
Welcome to the office. You're here.
I'm here.
You're finally here.
I really am.
Welcome.
Thank
How
you.
can I help you? Well, let's wait a second. Where are you coming from?
So I'm coming from Riverside.
Okay.
From the IE.
Okay, the Inland Empire.
Um,
Well, you mentioned something you've been following for
Since 2017.
since we started.
Yeah.
Go
Since
on.
my journey started as well.
Okay.
I had a back injury.
Okay.
A big one in 2017.
What happened? Was
when-
that after watching starting the channel or
No,
before?
it was before.
Okay.
The injury happened before, and then, basically I was doing I was working out. I was the fittest I've ever been, and I was on a squat press, and I just did the squat, came down, and then I just felt the yup, and then that was it, game over.
Hold on, squat press or leg press?
I guess it's the leg press actually.
You were like on an incline. You weren't squatting a bar on your shoulder.
Correct.
Got it. Okay.
Yeah.
Okay.
And
Can I ask though? Feet were like this, out or in?
I would say more like natural.
Parallel?
Yeah. I would,
Out or straight?
Honestly, I can't recall.
No problem.
And I recall just the whole sciatica burning down the leg,
Left
right?
side.
The whole shebang.
Okay.
And the degree of pain that I had was intense, and I couldn't really walk. It would just be burning the whole time. So I remember it was maybe like 2 weeks in, and I just thought, this can't be it, this can't be it. And
You didn't see anybody?
no, because I didn't know.
You didn't go to the doctor at all?
I went to an urgent care visit.
Okay.
And I think they just gave me like pain medicine, but after that, that's when I was on YouTube, and thank you. I was, on YouTube, and then that's when I found you, and I saw that you were in LA, and it was just amazing, right? But I always kind of just followed along, and I noticed that I couldn't find a local Gonstead doctor, and that's when
You mean out in Riverside?
Yes,
Okay.
and I went with him, and that's where my journey started with him,
Okay.
and fell in love with the philosophy. I believe in it, and it's really a blessing what the practice does for people, and I believe in it. So my journey continued, and
So you were seeing him for a while?
yeah, consistently. We worked a lot on my spine.
Why are you here then?
Well, that's the thing. It's almost like a full circle type of moment, because the way that I always felt my journey was kind of like undoing a Rubik's Cube. Like my spine, everything.
So I don't think everyone knows, because we have a lot of people that don't know what a Rubik's Cube is. Maybe we'll put one of those things on. Okay, those little cubes with the different color sides, and you gotta kind of... I figured it out in 4th grade once.
Nice.
That's it, once. That was it. Once I did it, and that was it. Okay, so your life is like a Rubik's Cube.
Yeah, as far as like my spinal health, I think every adjustment that I had was a different story, and it was just coming into
What do you mean?
alignment with myself. And
Oh, you mean as it was being released?
as it was healing.
Kind of like the onion. You were
Yes.
peeling the layers off.
Yes.
Okay,
Yeah.
all right.
And I got healthy. I was in alignment. But I always kind of had this residual kind of pain. There's something like deep, and that's kind of the best way to describe it. Something like it was almost
In
dormant.
the body?
Dormant, yeah. The sensation,
hip?
yeah, of the injury that I've always had in my left side. Although I could work out, I was doing squats, lunges, and stuff
Same
like
weight?
that. Sort of. I kind of went heavier because I got really fit. Like
Okay.
I got stronger, and I felt really aligned. I felt really good, but there was always something here. And last year, in November, I was put on the cumbias, and I was wearing heels, and I just remember just kind of like moving, and then I swung my left hip, and then something just felt like off here in my
Okay.
hip area for sure. The next day I was sitting down, and I was kind of wearing like these booted type of heels, and I was just having this posture for a while, and I noticed that my foot went numb, And I just, took off the shoe and I was kind of like rubbing it.
Numb meaning you have absolutely no feeling in it?
Well,
or it's
at
pins
the time,
and needles?
At the time of injury, was no feeling. It was like it went numb, like it's asleep. Kind of when you lay too long and you're waiting for it to come back and it's not coming back.
It's just not coming back.
It's not coming back.
Since November.
Yeah.
This is worse than the first time in terms of affecting your quality of life.
No, because before I really couldn't walk. Like it was in a lot of pain.
And now it's numb.
Yes.
Okay, so you're here because the numbness in the foot. How is the hip?
She's hanging on, but
Pain?
Yes, tightness.
Tight, limited mobility.
Yes.
Pain in the front, side, or back?
All around.
Whole hip.
I would say front, and then all.
More in the front?
No, I would say more in the back, and then the front is just hanging on to dear life,
You walk? Are you working out right now?
Not like lifting weight, barbell. No.
I was going to say no weights right now for a few visits.
All body.
Just walking.
Yeah, walking.
Just walking, cardio, swimming, elliptical with handles. Keep it simple for now. Just don't add any variables while we try to figure this out.
Absolutely.
Okay?
Absolutely.
All right, so numbness, left hip, front, side, kind of all of it.
Yes. Another symptom that I've also I have been having is a lot of cramping.
Cramping started recently.
No, it's been since the beginning. It's been at its peak.
The beginning?
Since the November injury. No, in November.
This time.
Yeah, since whatever happened here.
Okay.
I've got more sensation on my foot as far as, because it went from really numb to over time it just kind of have a little bit more sensation above like my foot, but my toe is just not it. Like I can't flex up.
Bring me the hand, bring me the leg. Just relax it there on my knee. You feel this?
I feel that.
Pressure?
No, just because I'm tapping. Okay, a little like, ooh, it wants to be ticklish.
You feel that?
I do feel the heel.
You feel that?
Yeah.
Feel that?
Okay, yes.
You feel it? Close your eyes. You feel this? You feel that?
Not right there.
You don't feel here?
Not right there.
Okay. Close your eyes. You feel this?
I do.
This? You can't close your eyes.
It just feels like...
Why you like going? Close your eyes. Close your eyes. You feel this?
It feels numb. I can feel like I can tell
Big
you're
toe.
running it here, but it's
So
not.
you're describing L4 right now. That's what we're going through. This is L5. You feel this?
L5? I do feel here.
You feel S1?
I feel S1.
You feel the bottom?
Yes, but if you run to the upper side like that, that's numb right there.
So this is L4. Tell me when you start to feel.
Right here.
Right there?
Right there.
You sprained your ankle too, right?
No.
Relax the foot. You sprained your ankle too at some point with bad mechanics in the gym early on. Okay. And this side is fine?
Yeah, that's good.
You can actually see too, if you look at her feet, bring your feet together, you can see this side is swollen. Okay? There was an old ankle. You feel that?
I mean, like sensation?
Yeah. You feel this?
I do feel that.
Okay, so she's got numbness, but she definitely has a sprained ankle too. Old sprained ankle. Okay? Alright, what else?
I can't dorsiflex.
Meaning you can't lift it up, so it's more like a foot drop with numbness. Okay, you feel this?
Yeah.
Same? 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 You feel that one?
I do.
You feel that one?
Yes.
Well, you're just just basic. we haven't done the full exam and X-ray. L4 is what it looks like. Does that sound familiar?
It does, yeah.
Okay. What else?
I generally feel like, I guess if we move up the spine, it almost feels like this compensation going, and also in my neck as well. I do feel the difference here.
Okay.
But more it's down here, I would say this area.
So this is an interesting case because she's actually a Gonstead patient. You know the work. You've been following for a while. You've been through treatment. We need to figure out this case.
Okay.
And see what's different. So number one issue is foot numbness, L4 nerve distribution, pelvis feels a little bit off, tailbone, and whatever else I find.
Yeah. You can see it in the walking as well. The whole leg is just more stiff.
We'll take a look at it. Digestion?
I think we're good.
Okay.
I would say so. I would say maybe I've noticed recently a little bit more like having to go to the bathroom more.
Okay.
And so also like when you gotta go, you gotta go.
Got it. So you can't hold it.
I can hold it, but it's I gotta go.
Number one, number two.
I would say two.
Okay. Not number one. You can hold number
I
one.
can hold number one.
Okay.
Yeah.
All right.
Yeah.
You ready to get started?
Yeah.
Let's do
Yeah.
it.
That's it.
So first thing we need to do is watch your walk. Come on over here. Let's do your walk. Welcome to the new office, guys.
Okay, let's go.
All right, so let's watch the walk and let's see what we got going on there. The dimples. Go ahead and walk. This is a different walk now. There you go. And let's watch the walk. I'm gonna sit over here. And you can come over here. I'll come right over here so you can see.
Come over.
Okay.
Is that good?
Yep. It's almost a foot drop. It's a foot
It
drop.
was worse. It was worse.
Yeah, it's a foot drop. You seen the case of
Yeah.
the
you're
guy with
exactly-
his wife?
Oh, I was just like, okay, dog, call him my name.
Interesting.
Yeah.
Right foot, left
So
foot
it's
drop.
like- so even turning around corners is tough. I have to kind of just like
Yeah.
adjust
Stop
myself.
right there, march in place. Turn a little bit this way, march in place. Okay, keep walking. All right.
Just like stick it every day, you know, just like, all right, let's go.
Let's go over your x-rays. Come.
Okay.
There's a foot drop. So, this is your building, this is your foundation. As you know, in order to have a stable building, we need a level base and foundation. And we do see that there's misalignment of the pelvis. I don't know what your old, maybe you can get me old x-rays for comparison. Okay, that would be kind of cool. AS5, EX6 with a short leg on that side and a little bit of drop sacrum. Okay?
Mhm.
And again, I don't know what it looked like before,
Mhm.
but the drop is creating this curve going to the right side, but it
Mhm.
goes the whole way up to there. Did you ever do bar squats
Yeah,
back in the day?
yeah.
Okay. So all of this is compensating. This is what's interesting. It's starting here.
Mhm.
I'm going to go in more detail. I'm
Mhm.
giving you the gist. It goes all the way, the overall, all the way
Mhm.
to there.
Mhm.
And then, so that none of that should actually be touched.
What do you mean touched?
It's all compensation to the foundation. All of this, look, generally, I'm giving you the global perspective. The global perspective of your spine is this. This whole thing, I'm going to use the cursor, this whole thing curves to the left. So to fix, if there is any fix, it's got to be all foundational work.
Mhm.
Does that make sense?
Yeah.
If there's nerve pressure there, of course we'll deal with it.
Mhm.
But adjusting here, here, and here is not doing anything.
Yeah.
Nothing is holding. I already know that.
Yeah.
Okay? Sound about right?
Wow.
Yeah. Now, if we go deeper and say, well, where is it actually going from? From 5 is going all the way to a key. 1, 2, 3, 4, 5. Interesting. Okay. So T5, 1, 2, 3, 4, 5. Everything from L5 to T5, 1, 2, 3, 4, 5, is compensating. This whole thing is a compensation to this. Okay? And now let's go deeper. Did you know this?
I felt it.
Did anyone explain it?
No.
Okay.
But I've always like if I imagine it and I can see it in me, I have always felt that here.
So basically that's your major is this. Whatever the foundation is comes up to 5.
Mhm.
And then 4 starts to go the opposite way.
Mhm.
So 4 is a potential, and 4 is part of the heart chakra.
Mhm.
Okay. Why does he talk about chakras?
All related.
It's all related. Look, and then the whole thing curves where? To that side. So your answer is 4, whatever's going on in the upper cervical. Okay,
Okay.
we'll get to that. But it's foundation. And what I saw on the other x-ray is one of the majors over here. Okay, and what I see is this. Okay, when we look at your overall side profile, what do we see? You do have
spacing.
the spacing is all there. We're looking at spacing, curve, and and posture, right?
Right.
So if we take the posture line first and run the plumb line from here, we already know the upper body sits behind the foundation. So we know there's also tightness and stuff going on here. We know that, right?
Yeah.
Okay. However, if we go down low now and see, okay, yeah.
Mm-hmm.
So that's 5, that's 4. Now here's the interesting part. You know, I have a suspicion it's normally a thin disc like 3. It's open in the back. I just had a case like this that was an acute open in the back, which is a more miserable situation. Then typically the vertebrae do what? Typically the vertebrae go back and tilt.
This one's in.
No, this one goes up.
Up.
So typically misalignment of the vertebrae dislodging off the nucleus in the Gonstead method is explained that it dislodges like this and it tilts back. But your case, and we've seen many cases, it misaligns back and goes up. That's a worse situation. But then look, it's almost, this is open in the back. This is closing, creating a little spur right there. 4 is your culprit. But before we can get to 4, dude, 4 is it. But before we can do that, let's look here. You got a bent coccyx. I'm gonna have to.
Oh my goodness!
It's bent.
You can see it. Yeah. It's like.
Look, this.
Thin.
Okay.
Yeah.
So, that's what I see.
Yeah.
I see here, but then I also see S5. I also see S3. So there's a few things going on.
Yeah.
But the idea is, number one is, what's the one causing that?
Right.
I have a suspicion that the tailbone wasn't addressed correctly.
Okay.
That's my opinion. But I don't know until I examine you. And I'm not saying the right things weren't done, good or bad, but one thing may have been missing.
Yeah.
Okay? So 5 is a little thinned out, but 5 is level.
Okay.
4 is open in the back, 3 is closed in the back.
What does that mean, the difference between these two right here?
So if we look, good question, very good question. Look, this is thin in the back. It's also pinching.
Because it's pinched, it's like closed
No, but yes, but it's creating a spur. That spur tells me this one was more unstable. This is 25 years ago. This wasn't 2017. This wasn't 2017. This wasn't 2017. You got old traumas, lady, that we haven't even discussed. And you're holding anger in there that you need to let go of. You ready to let go of it?
Oh yeah, I'm ready.
All right. And that's part of so this is all 25 years old. What happened 25 years ago?
I don't know. But I do remember growing up, I wasn't
Where'd you
able
grow
to
up?
like...
Where'd you grow up?
In Montebello.
Okay, cool.
Yeah.
Siblings?
I do, yeah.
Older?
2 older, 1 younger.
Brothers?
Two brothers, older brothers, and my sister.
And your
It's 4
sister?
of us.
Sister younger?
Yeah.
Coccyx 5'3", 5'4", 3. This is there's a story there you're not saying. It's okay. It's fine. We don't have to get into it right now. Then you can see from here the spine kicks back.
Right.
And then this is old compression. You don't need to be doing squats. Old compression injuries.
Okay.
The shape of that bone is changing shape. That's a level disc. That's a jaggedy vertebral end plate. Please don't mess with that.
Okay.
And then we have a reverse curve going on.
Okay.
Okay. So I don't like working in reverse curves. There are a few exceptions. Upper cervical, if it's there, we'll deal with it. But as I said, T4. I'm telling you, this is what I see. T4 is your major. T4, T5 maybe. And figuring out this before we get up here.
Okay.
Pelvis is there. Yes. Pelvis is there. The misalignment is doing this. So they work in opposite. One goes forward, the other goes back. One goes in, the other goes out. When we see PIIN or ASEX, that's trauma.
Okay.
Which one is it? We'll examine you and figure out. It will not change the 5 millimeter. Regardless, it's under 7, adjustments will hold.
Okay.
Okay?
Okay.
You ready?
I am. Yeah.
All right, let's do it. Question?
I'm wondering one thing about the coccyx and how does that relate to, I guess, how it goes up the spine? Because
it's okay. So
I almost like how I envision it in my body. It feels like a stream. Like if it's all the way to the tip of the coccyx, all the way to the top, and then figuring out this whole compression that's going on, it almost feels like it's been contained in that, within that space, but it's also been kind of been shifting around, and that's what it feels like in my body.
Let me explain it this way. You've heard me explain in videos?
I think so.
Yeah, right? So it is the string, the filum terminale, that ends at the coccyx and maintains the tone. The tone. If it bends forward, you lost tone. Body compensates. If it goes back, it's too tight. Usually it misaligns forward though. Not always, but I'd say most of the time. We were taught it only goes anterior, but I've seen some posterior ones as well. Okay? Now, that's key.
Yeah.
And hopefully we're able to get it if we find it.
Okay.
So we still have to find it.
Yeah.
Right now it's all talk.
Yeah.
Okay?
Alright.
Now we gotta get to
Okay.
work.
Okay.
Have a seat right there in the chair. All right, let's do this. Starting at the base of the neck. Head down, please. It could be an upper cervical coccyx. That's not allowing it. Who knows? Starting at the base. First thing, there it is. 15 points. It's actually higher up. Maybe occiput. You ever had occiput?
I don't think so.
Yeah, that's occiput, left side. Doo-doo. T4 hiding out, 5 points. Now, the question is, if we have two things, parasympathetic and sympathetic, can I bring these down?
Yeah.
If we have sympathetic, parasympathetic, do we want to mix systems in your case? Is there any visceral things going on? Digestion, heart, any medications?
No.
Okay. Now, with a thinning disc, we can get a cold nerve. So now we start to tilt the scope. This is part of the art. And we can see it comes out right there. You don't get it this way. Interesting. She has double nerve pressure at her L4, dude. That's why it didn't show up. Double nerve pressure, L4. All the way down. There it is. S5 coccyx, L4, T4 occiput. That's what I'm finding. Double. So what happens when we're looking initially for the hot nerve, right? That's what the meter picks up. But when the nerve has been pinched for so long, it goes from inflammation to what? It goes cold. So you then start, there's an art to tilting the scope that we learn. And people have made comments in the past, oh, why is he tilting it? He's not doing it straight. And that's the art.
Right.
Okay? That's the art. And as you guys learn the scoping out there for the students and young docs, hopefully they learn the tilting of the scope and what the significance is. All right, this is 5. Tender.
All right.
S1. S2. S3. S4. S5.
She's a little tender right there.
I'm going to go lower on the outside, okay? That's the one.
That's the one. Yep. Ooh, I got like chills everywhere.
5. 1, 2, 3, 4. Outside. Is it coccyx? Right side, left side.
Ooh.
Right, left.
Oh, that right is like
Right
burning.
seems more to me.
Yeah.
Okay. She got all sweaty on me.
Yeah. Just waking up.
Head down. Gotta wake up that coccyx, girl. People think it's a joke, dude. It's not a joke. I mean, we make it kind of light, okay? Because people coming in serious stuff, dude.
Yeah, they've been living with it.
Okay, 4, 3, 4, 5, 4, 4. 5, 4. Now, let's check the pelvis, okay?
Let's do it.
Scoot forward a little bit, feet touching.
Okay.
Feet are touching. I'm grabbing here, okay? I'm grabbing the SI joints, top of the iliac crest. Feet together, open and close your knees with your feet touching. Open and close, open and close. Mariposa. Right only, keep
Right
going.
only.
So when she does the right, the left wants to shift.
Okay.
Left side only.
Left.
When you do the left, it's not so much fixation here, it's fixation there. L4. Coccyx 4-4 occiput. I'm okay doing coccyx in 4 if you are.
All right, let's do it. Knee chest?
Lady, I got a check still
Oh.
up. Relax.
Oh, okay, great.
Come on, yo. Hey, just because you had a few Gonstead adjustments, don't be trying to tell me how to run my practice, yo. I told the last patient, this ain't a la carte, dude. Trying to tell me, this ain't a la carte, this ain't Burger King, all right? You don't have it your way, but you get what you want. Sorry, you get what you need. It ain't Burger King, okay?
Got it,
You got it?
Got
It ain't Chipotle either. This is bespoke. It's bespoke chiropractic. Bespoke Gonstead chiropractic. It's giving you it tailored exactly to what you need. Yeah. All right, stand up. Oh no, sorry.
Yeah.
So you tripping me out now. Right side. Occiput. Key. You a self cracker?
No, I don't like that.
Right.
No.
Stand up.
Okay.
Stand up. I'm just going to turn the chair.
Okay.
And I'm going to bring it back here.
All right.
Okay, have a seat. So we got to do the right coccyx. We got to do the T4. I'm going to wait on the occiput for a minute, okay?
Okay.
Or we have to decide. We have 4 and 4. This is an interesting case. You have the very top occiput, the very bottom coccyx. And then you got
T4.
T4 and L4. What do I do, guys? Foundation.
Yeah, foundation.
Why don't we do foundation first?
Okay.
Have you walk, reach out.
Okay.
Fair?
What's it?
Let's go left side down. Am I okay with this leg?
Yeah.
Hook it.
Hook it.
Hook it.
It's in place.
Ugh.
Locked in.
I'm here, okay? Madam?
Yes.
Let it roll. Gotcha.
Mm.
Give it a second. Push yourself up, swing your legs down now. Baby cobra.
Baby
cobra. Stand up, please. Let's walk a little bit. Let me just move this.
Sure.
And walk it off a little bit.
Wow.
Your
It
baby
almost
cobra.
feels like my right side just kind of feels better too.
With the baby cobra?
Just with the baby cobra.
That's a baby cobra. It's changed, right?
Yeah.
What's different?
It feels just,
Different.
yeah, different.
Come over here. Come on over. Let's see what happens. Is it different to sit right now?
Yeah, it is.
That cleared your neck.
Yeah.
T4 is still there. L4 is more pronounced.
Okay.
All right, 4 and 4. I'm not doing the occiput right now or upper cervical, okay?
All right.
T4 and L4. You want the knee chest for L4?
Yes.
Okay. Bring your chest up higher, please. I'm going to bring it down a little more. Is that more comfortable?
Oh yeah.
Knees back, please. Knees back. And drop let the belly button go down. Do some cat camel. Belly button up and down while I look at the x-ray. It's a different set though because it's open in the back. Tummy up, up, up. 5, 4. Aquí. Up, up. Okay. Let the tummy relax down, please. All the way down. All the way down. No. Knees back. Okay, go. Back. Okay. You okay there?
Yeah.
Tummy up and down. No, I can't get through it there. Come up slowly. We're gonna have to go on this table, okay? Oh, so we gotta come down because it's jamming on 3. Let's see. So normally we want to lift up. Okay, relax the shoulders, please. That's the home run. Gotcha. Sorry, I had to. There you go.
Oh man.
How's your foot? You're dorsiflexing, you know that?
Yeah.
A little bit.
A little bit more.
Come on.
Trying to hold it. I'm trying to
Down.
hold it. Come on.
Right. Keep going. Awesome. Get your other foot on there if you can.
Yeah, there you go.
Forward. That's the home run, dude.
Yeah.
Hold on.
That was wow. Okay.
You never got that. You ever get that? You got that
Yeah.
before?
No. It's pretty legit.
Walk it up.
Even bringing my knee up is so much better. It feels like it has some movement now. Thank you.
Walk it out.
Let's walk it out.
Check it out. Check it out. You're gonna walk back and forth several times. And as you're walking, anything different?
Absolutely.
What's
My
different?
knee, just the movement here just feels more alive.
Bring that hip up. Bring the left hip up.
It's like head
Yeah.
up, head up. We're hiking up. We're hiking up. Let's
Hike it
go.
up. Hike it up. Back over here. Grand finale T4.
Okay, oh yeah.
Still gotta do T4 heart chakra and get rid of all that anger.
Let's open it up.
Palms up to receive. That's the home run, baby. We won't address the pelvis today, obviously, but we will address it at some point. Okay? I did coccyx S4, coccyx L4 T4. Now walk. What's different?
Oh my gosh. Relief. It feels like relief.
Have a seat. Let's rescope you.
Okay.
And then I'll set the, I'm not gonna go too deep on the ankle, but I will set it to get it moving, okay?
Okay.
Clear. 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 Clear.
That's right.
Clear.
The L4 adjustment felt like a spark.
Power on. Spark meaning what? Power?
Yeah, like light. It felt like light.
Boca arriba. Raise the left leg. There you go. All right, come on up. We're all set for today. That's where we're going to start. Walk it off last time.
Let's do it.
Walk it off last time, please.
Walk it out.
Is that a little more different with the ankle?
Yeah.
Right?
Wow. Yeah.
Good. Bueno. Come over here. And let's do the hands.
Ooh.
What?
Nice.
Squeeze. Nope, stand. Right here. Squeeze. Relax. Elbow.
Yeah, this is bugging me.
Squeeze. Radial head.
Ooh.
Lunate.
Ooh.
Scaphoid. Thumb. Turn. Ears.
Nice.
Questions.
No, but thank you so much for everything.
Welcome to the office.